Hello everyone. I'm myself Dr. Rajesh Gubba. I'm the general medicine educator. In this session, I'll be discussing a very important type of vasculitis, that is cryoglobulinemic vasculitis. So first of all, you should know and you should understand what are cryoglobulins. Let me just tell you first what are these cryoglobulins. See, these cryoglobulins, they are basically the immune complexes. And these cryoglobulins are the one which are responsible for the development of vasculitis, right, where there is inflammation of the vessel wall. And these cryoglobulins, they are cold precipitable immune complexes. Right, they are cold precipitable immune complexes. Now, what does this immune complex contain? See, this immune complex, it consists of rheumatoid factor and IgG, right? It contains rheumatoid factor and as well as the IgG, right? And these immune complexes, they go and get deposited in the vessel wall, causing the vasculitis, and that is what is called as cryoglobulinic vasculitis. Now, if you see the type of vasculitis in cryoglobulinic vasculitis, cryoglobulinemia, it can be associated with immune complex mediated small vessel vasculitis. So the type of vasculitis what you will have is right, the type of vasculitis that you will have is the small vessel vasculitis. So what are those small vessels which are affected? That includes arterioles, venules, and then capillaries. Okay, so these are the structures which are affected in case of small vessel vasculitis. And what are the other examples of small vessel vasculitis? That includes Church-Strauss syndrome, number 2, Henon-Schollen's purpura, number 3, microscopic polyangiitis, and then Wegener's granulomatosis. So these are the other examples of the small vessel vasculitis, right? Now, what are the etiologies, right? What is the cause for the development of this cryoglobulinic vasculitis? See, chronic infection with hepatitis C, that is the most common underlying condition which will cause the cryoglobulinic vasculitis, that is hepatitis C infection. Right, so that is the most common cause. And this cryoglobulinic vasculitis, it can also occur with other chronic infections, right? It can also occur with other chronic infections. So these other chronic infections, they include right, they include subacute bacterial endocarditis. Even in patients with subacute bacterial endocarditis, there can be development of this cryoglobulinic vasculitis. And right, it can also occur secondary to osteomyelitis, and it can also occur secondary to HIV, and it can also occur secondary to hepatitis B. So these are the other chronic infections which are responsible for the development of cryoglobulinemic vasculitis. And with connective tissue diseases and with lymphoproliferative diseases. See, this cryoglobulinic vasculitis can also be associated with other connective tissue diseases. Right? And what are the other connective tissue diseases? Especially Sjogren syndrome. Okay, so these are the other connective tissue diseases which are responsible for the development of the cryoglobulinic vasculitis. Next, now you take these cryoglobulins, we have three types: type 1, type 2 and as well as type 3. So some of the cryoglobulins, they are like monoclonal proteins and some of them are polyclonal proteins. Let me tell you. So you take type 1 cryoglobulins. Type 1 cryoglobulins, they are cryoprecipitable monoclonal proteins. Right? They are cryoprecipitable monoclonal. So cryoprecipitable means these immunoglobulins or these proteins, they get precipitated in extreme cold. That is called as the cryoprecipitable monoclonal proteins. And these cryoprecipitable monoclonal proteins, they lack rheumatoid factor activity. Right? They lack rheumatoid factor activity. Okay, what did I say you about the cryoglobulins? Cryoglobulins, they are nothing but the immune complexes. And what is there in the cryoglobulin? It is the complex of the rheumatoid factor and as well as the IgG. But in case of your type 1 cryoglobulins, they lack the rheumatoid factor activity. And these type 1 cryoglobulins, they cause cold-induced hyperviscosity syndromes. Right? Cold induced hyperviscosity syndromes. Not vasculitis. Type 1 cryoglobulins, they don't cause vasculitis. They cause cold induced hyperviscosity syndromes. And these type 1 cryoglobulins, they are associated with B-cell lymphoproliferative diseases. Right, they are associated with B-cell lymphoproliferative diseases. Then you take type 2 cryoglobulins. Now these type 2 cryoglobulins, they are also monoclonal proteins. Right, they are also monoclonal proteins. But the difference from type 1 is that they have the rheumatoid factor activity. Right, they have the rheumatoid factor activity. That is what is the difference between your type 1 and as well as type 2 cryoglobulins. And this type 2 cryoglobulins, they are associated with the development of the vasculitis. Whereas type 3 cryoglobulins, they are or they have polyclonal activity or polyclonal proteins. Okay, so that is about your type 3 cryoglobulins. Type 1 cryoglobulin, it's a monoclonal protein and it doesn't have the rheumatoid factor activity and it does not cause vasculitis. It will cause only cold-induced hyperviscosity syndrome and it is associated with B-cell lymphoproliferative disease. Whereas type 2, it is having or it is a monoclonal protein with rheumatoid factor activity and it causes the vasculitis. Whereas type 3, it is having the polyclonal protein activity. So, after having discussed about the types of cryoglobulins, let me discuss what will be the clinical features in these patients with the cryoglobulinic vasculitis. So, the clinical findings in case of the cryoglobulinic vasculitis, it typically manifests as recurrent palpable purpura. Right, recurrent palpable purpura. And this recurrent palpable purpura, it is predominantly distributed on the lower extremities. Right, predominantly distributed over the lower extremities. And apart from this recurrent palpable purpura, the other manifestations include the development of peripheral neuropathy. Right, development of peripheral neuropathy. Next, apart from these two, right, these patients, they also have involvement of the kidney. And this involvement of the kidney will be in the form of a proliferative glomerulonephritis. And this proliferative glomerulonephritis may develop and it will manifest as, right, it will manifest as rapidly progressive glomerulonephritis. Right, it will manifest as rapidly progressive glomerulonephritis, that is RPGN. See, what is the importance of this RPGN, that is rapidly progressive glomerulonephritis, is that when you take a biopsy in case of the rapidly progressive glomerulonephritis, biopsy will show you the presence of the crescents. Right, so the other name of this rapidly progressive glomerulonephritis is that it is also called crescentric glomerulonephritis. And in these patients with the cryoglobulinic vasculitis, there can be even abnormal liver biochemical tests. Right, there can be abnormal liver function test, and there can be even there can be even the abdominal pain, digital gangrene, right, digital gangrene, and pulmonary diseases may occur. Right, pulmonary disease may occur. So these are the clinical findings in patients with the cryoglobulinic vasculitis. So please remember this very important point. Most common manifestation in cryoglobulinic vasculitis, that will be in the form of palpable purpura, and that is mainly distributed over the lower extremities. Then how will you diagnose this cryoglobulinic vasculitis? So the diagnosis is based on a compatible clinical picture and a positive serum test for cryoglobulins, right? So positive serum test for cryoglobulins apart from the clinical picture. And not only that, in the diagnosis of this cryoglobulinic vasculitis, the presence of a disproportionately low C4 levels, right, the presence of disproportionately low C4 levels or rheumatoid factor, right, or even there can be presence of both, right, even there can be presence of both, even that can be the diagnostic clue to the presence of the cryoglobulinemia, right? This can be even diagnostic clue to the presence of cryoglobulinemia. Okay, so this is about how you will diagnose the cryoglobulinic vasculitis. Now, how will you treat these patients? let me tell you, the most common etiology is the hepatitis C infection. So antiviral regimens are the first line therapy for hepatitis C infection. Right, the antiviral regimens, they are the first line therapy. Right, they are the first line therapy for hepatitis C associated cryoglobulinemic vasculitis. And interferon free direct acting antiviral agents, they are preferred because of excellent long-term response in the clinical trials. So among these antiviral agents, what is that you have to give? Interferon free antiviral agents. This interferon free, right, this interferon free antiviral agents, they are preferred. Why? Because of excellent long-term response right, because of excellent long-term response in the clinical trials. So this is about the treatment of the cryoglobulinic vasculitis. Now, these antiviral agents, they include sofosbuvir, right, sofosbuvir. So this is the antiviral agent against your hepatitis C, and it is the interferon-free antiviral agents. Now, in patients with severe cryoglobulinic vasculitis, what do you understand by the word severe cryoglobulinic vasculitis? That includes the presence of extensive digital gangrene, right, presence of the extensive digital gangrene. Number 2, extensive neuropathy. Number 3, rapidly progressive glomerulonephritis. Okay, rapidly progressive glomerulonephritis. So patients with severe cryoglobulinic vasculitis and hepatitis C should receive immunosuppressive therapy. Right, should receive immunosuppressive therapy. And this immunosuppressive therapy, it is with corticosteroids. Right, it is with the corticosteroids. And the other immunosuppressive agents that can be given is Rituximab or cyclophosphamide. So these are the agents that you have to give in individuals with severe cryoglobulinic vasculitis. Okay, so please remember, this is a very, very important point. Wherein, what do you understand by the word severe cryoglobulinic vasculitis? Where there is presence of extensive digital gangrene, extensive neuropathy, and development of rapidly progressive glomerulonephritis. And along with that, there is hepatitis C infection. They should receive the immunosuppressive therapy with steroids and either rituximab or cyclophosphamide, as well as the antiviral treatment has to be started. So this is about the treatment of the cryoglobulinic vasculitis. So this completes the topic of this cryoglobulinic vasculitis. So what are cryoglobulins? They are nothing but the immune complexes. What does it contain? It contains the immunoglobulin, that is IgG, along with the rheumatoid factor. And these cryoglobulins, they accumulate within the vessel causing vasculitis, and it is a small vessel vasculitis. And most common causes the chronic hepatitis C infection. And apart from that, subacute bacterial endocarditis, osteomyelitis, HIV, and hepatitis B is responsible for the development of this cryoglobulinic vasculitis. And it is also associated with other connective tissue disorder, that is Sjogren's syndrome. And we have three types of cryoglobulins. Type 1, you don't have rheumatoid factor activity, but it is a monoclonal protein and it does not cause vasculitis. It is only responsible for hyperviscosity syndromes. And type 2, it has a rheumatoid factor activity, and along with that, it is a monoclonal protein which is responsible for cryoglobulinic vasculitis. And type 3, it is a polyclonal protein. And most common clinical finding is the what? That is recurrent palpable purpura. And along with that, there will be peripheral neuropathy, rapidly progressive glomerulonephritis, abnormal liver function test, and abnormal pulmonary disorders. And diagnosis is that mainly by the clinical picture and positive serum test for the cryoglobulin, right? And there will be disproportionately low C4 or rheumatoid factor, or even both can be diagnostic clues for the presence of the cryoglobulins. And treatment, mainly you need to give the antiviral regimens, and in patients with severe cryoglobulinemic vasculitis you need to give the immunosuppressive therapy, that is by steroids, or you can give Rituximab or cyclophosphamide as along with the antiviral agents. So this is about, in short, related to your cryoglobulinemic vasculitis. Thank you very much.